Welcome, everyone. We're letting participants take a few minutes to get registered. There's a lot of numbers coming in here, so we'll get started in just a moment. All right. Welcome, everyone, to our patient education webinar, From Prescription to Payment, A Patient's Guide to Lymphedema Benefits and Billing. A couple of quick notes before we get started. Please use the Q&A tool down at the bottom of your screen to submit questions during the webinar. We'll answer those at the end in a dedicated Q&A session. If we're not able to get to your question during the webinar, we will have a follow-up email that goes out to everyone that includes a recording of the webinar from today. That will also include answers to any of those open questions. So I'm Adam Van Essen. I'll be moderating today, and we're joined by three presenters. So we have Heather Ferguson, the founder and executive director of the Lymphedema Advocacy Group and the Lymphedema Education and Awareness Project. The Lymphedema Advocacy Group, or LAG, led the effort to pass the Lymphedema Treatment Act and focuses on policy progress. The Lymphedema Education and Awareness Project, or LEAP, was launched after the success of the Lymphedema Treatment Act to help patients understand and use the coverage now available, and focuses on education and supporting patients. We also have Noel Neal, from the Chief Compliance Officer from AcuServe. AcuServe works behind the scenes with medical suppliers to manage insurance billing and required paperwork by helping providers understand coverage and claim requirements for lymphedema compression supplies. They support smoother access for patients trying to get their insurance benefits. And Carmen Anderson, a consultant with the U.S. Medical Compression Alliance, or USMCA, which is a coalition of industry stakeholders that's dedicated to improving access to medical compression therapy through advocacy, education, and collaboration. So here's kind of the path we're going to follow today. We'll be talking through the requirements for coverage, how to find a supplier, how to choose a supplier once you've reviewed the suppliers available to you, and how to get a garment, understanding your explanation of benefits, appealing denials, and addressing incorrect claims if you do run into any issues. We'll also review some additional insurance-related resources that are available to you, and then have that Q&A session at the end. So a reminder to submit those questions as we go through. This just kind of reviews the flow of the high-level overview of what we're going to be reviewing today again. So those requirements for coverage, finding and choosing your supplier, and then how do you troubleshoot if the issue does come up. With further ado, I will pass it over to Heather Ferguson.
All right, good afternoon, everyone. To start us off, I will go over the requirements for coverage and also go over a brief review of the coverage provided under the Lymphedema Treatment Act. Next slide, please. So the requirements for coverage are going to be the same under any insurance plan. You will need to be diagnosed with lymphedema. You will need a detailed prescription for all compression supplies, and you will need clinical notes that support the medical need for each prescribed item, especially if any of them are custom fit. If you are a Medicare beneficiary, as of January 1st, 2024, thanks to passage of the Lymphedema Treatment Act, your insurance is required to cover your lymphedema treatment items. If you have original fee-for-service Medicare, your coverage will be under Part B, and like all durable medical equipment covered under this category, after you've met your deductible, Medicare will cover 80% of the cost and you are responsible for 20%. And if you have a secondary or supplemental plan, that may cover your 20%. Your coverage allowances with original Medicare are 3 sets of daytime garments every 6 months, 2 sets of nighttime garments every 2 years, and no set limit on bandaging supplies or accessories. If you have any insurance plan other than original Medicare, however, including a Medicare Advantage plan, these coverage allowances and your cost sharing will likely be different and will depend on the terms of your plan. Next slide, please. Regarding your lymphedema diagnosis, you do not need to be diagnosed by a lymphedema specialist, as most people don't even have access to a lymphedema specialist. Any clinician within their scope of practice can provide the diagnosis, and this includes your primary care physician. The 4 eligible diagnosis codes are shown on the slide. And if you are a woman with breast cancer-related lymphedema, it's very important that your diagnosis code reflect that so that you will be eligible for additional benefits and protections under the Women's Health and Cancer Rights Act. And lastly, for all patients, it's important that your diagnosis code is in your physician's record, not just on the prescription or in the clinical notes from your lymphedema specialist. Next slide, please. Now we're going to go over how to find a supplier. It's always a good idea to ask your lymphedema therapist and/or doctor for recommendations, as they are likely aware of the local options. They also tend to know which suppliers have the most experience, which can be important, especially if you need a custom fit item. You can also try using the Medicare Equipment and Supplier Search tool, even if you don't have Medicare, because any supplier who accepts Medicare typically accepts other insurance plans as well. When it comes to lymphedema compression supplies, however, we've found that the Medicare directory is often inaccurate, meaning it lists suppliers who don't actually sell lymphedema treatment items, and it's also incomplete, meaning that there are many suppliers who do sell lymphedema treatment items but are not in the Medicare directory. This led our group to launch our own lymphedema supplier directory last year, and I'll talk more about that resource on the next slide. And lastly, no matter which of the above methods you use to find a supplier, you should always check with your insurance plan to verify if they are in network. Even if the supplier tells you they are, you should confirm this for yourself. Conversely, you may also wish to begin your supplier search by contacting your insurance plan and asking for a list of in-network suppliers. If you do so, you will still need to contact each one to see if they actually sell the item you've been prescribed. Our group has heard from a number of patients who've contacted every supplier on a list from their insurance company, only to find that none of them actually sold the items they needed. Later in this webinar, we will cover what to do in situations like this when your insurance plan does not have an in-network option that meets your needs. Next slide. So our new lymphedema supplier directory is a free resource for patients and suppliers. You can use it to find both local businesses as well as those who sell nationwide, and it contains much more than just their contact information. The listing for each supplier includes the types of compression items they sell, the types of insurance they take, and more. New additions include businesses that manufacture and sell shoes suitable for lymphedema feet, and each supplier can now identify which major brands of compression garments they sell. This ability to identify brands is recent, and most suppliers in our directory haven't had a chance to update their profiles yet to include that information, so you may not see those details now, but you will in the near future. And we are committed to continuing to improve and expand the directory to make it the best, most comprehensive resource possible. And now for the next portion of our webinar, I'm pleased to turn it over to Carmen Anderson.
Thank you, Heather. I appreciate it. So I'm going to be talking about the process for getting your garments. We'll start with a high-level overview, and then we will dig a little bit further into choosing the supplier and what sort of information you should be prepared to address when you do that. So when you first realize or recognize that you have lymphedema or having symptoms or having issues, you will have to schedule a visit with your clinician. There are a couple of different clinicians that you may see during this process. That includes a physician and potentially a lymphedema therapist as well. So important to get in front of those clinicians and so that you can then discuss your treatment plan. So determine how you are going to treat your lymphedema. During that interaction with the clinician, you're going to request documentation. So every time that you go in to see a clinician, you know that they're typing on the computer, making notes in the medical records. And one of the key components of the Lymphedema Treatment Act and the integration into coverage and eligibility for Medicare and or other insurance companies is having that medical record documentation on file. Within that medical records, it's important that there is a diagnosis code captured in that medical record by your clinician, and specifically your doctor that oversees your care at large. So within that, you'll need to advocate for an ICD-10 code diagnosis for lymphedema. We'll dig into that a little bit more as well. It's also important that you choose a DME supplier. So once you've gotten that prescription for your compression garments, you'll need to find a DME supplier to provide those garments to you. Within that process, you'll get measured and fitted for your compression garments, and then you may also need to make a payment as well. So we'll go to the next slide. So some of the things that you should consider when you're choosing a DME supplier to work with. You want to ask questions. I know that it can be really difficult, but you have to advocate for yourself. You all have done a wonderful job for that. And of course, with Heather leading the charge over the past decade plus for advocating for coverage. But now that insurance is involved, that medical record documentation is an important part of that. And then working with a supplier that meets your needs. So you want a DME supplier that understands lymphedema, understands the Lymphedema Treatment Act, and that they also understand how to work with your insurance or what to do if your insurance is potentially not covering things. So we'll go into a few more details of what you need to know before you go see a DME supplier. So let's go to the next slide. So some of the questions that you can ask when your DME supplier is, are they knowledgeable about the Lymphedema Treatment Act? Do they know the history? Do they know how the implementation went for Medicare? And how are they navigating implementation with other private payers or commercial payers, Medicare Advantage, or Medicaid? So do they understand what the Lymphedema Treatment Act entailed? And do they understand how other insurance companies are adopting that coverage guidance as well? You will also want to know, what is their experience with lymphedema specifically? Is this a product that they have supplied for a long time, or is this something they recently started carrying? What's their knowledge base for lymphedema and the different treatment options that are available? You'll also want to ask, do they carry multiple brands or specific product options? So when you are diagnosed with lymphedema and prescribed compression garments, there's a variety of different products on the market, depending on your stage, on your severity, the symptoms, and also depending on your clinical mobility or some of the different issues that you may have. You may need different products or additional products. And so you want to know, does that DME supplier carry the specific kind that you need? So good to ask questions and know that they have appropriate brands available for you. Another thing you'll want to ask is, do they have qualified fitters with measurement experience? So a key component of medical gradient compression being effective is that it's fitted appropriately to your body. There's two different types of products. There's standard off-the-shelf products, or there's custom made to measure products. And that entails getting measured by a fitter to make sure that you can either fit into the standard off-the-shelf products, or possibly identifying that you need a custom product built uniquely to your body. So you want to make sure that that DME supplier has a qualified fitter that understands everything that takes place during that process, so you get the right garment that fits your body and is able to provide effective gradient compression. Another question to ask is, what is their follow-up plan and what additional services do they provide? So with gradient compression products, there's a variation for warranties and for custom products and expected lifespan of those products. It can vary anywhere from 6 months to 1 year, and of course 2 years as well for some of those other products. And so you want to understand, how is that DME supplier going to navigate getting you additional garments when that 6 months or 2 year mark has come up? And then how are they going to help you with any challenges that may arise with fit or effectiveness of the product? So making sure you ask those questions up front so you have a positive experience. Next slide. And then what about insurance? Of course, there's been a lot of change with the implementation of the Lymphedema Treatment Act. While some insurances covered this before, many of them are still new in the adoption phase. And so you want to make sure that your DME supplier understands how your individual insurance plan is covering products under the Lymphedema Treatment Act. So some of the questions that you can ask your DME supplier is, are they able to verify your benefits and then explain your out-of-pocket cost up front? So you want to know, what are you going to be expected to pay for these products once they submit the claim to your insurance company? Another question that you can ask is, are they a participating supplier for Medicare? You'll see that arrow that points over to the QR code on the right-hand side of the screen. Medicare has specific rules for being an eligible provider for Medicare beneficiaries. So a DME supplier has to be enrolled, and then they have some variation in whether they're a participating or non-participating supplier. That QR code on the right-hand screen will give you some additional information, and I believe we'll also dig into that further on in the webinar. Another question that you want to ask is, are they in network with your specific health plan? So DME suppliers have contracts with insurance companies, and that's what negotiates the payment amount for specific products and services that they supply. Typically, when a supplier is in network with insurance, it's a lower out-of-pocket cost to patients. So there's a difference between in-network and out-of-network. You'll want to ask them, if they are out of network or if they don't have a contract with your insurance plan, are they going to request a gap exception? And a gap exception means they're going to ask your insurance company to make that exception and only charge an in-network rate. The effort there is to try to get a lower out-of-pocket cost for you as the patient. So you want to understand, are they in-network and contracted with your health plan, or are they out of network, not contracted, but potentially going to request for an exception? A lot of that can be overwhelming information. So again, this webinar will be recorded. We'll share this with you, but these are some of the questions that you can ask. Really getting down into it, you may want to ask, do they charge according to the Medicare fee schedule? So since Medicare drove the eligibility and adoption of the Lymphedema Treatment Act, they also published payment amounts for those HCPCS codes or product type things that get submitted on a claim. So those national payment amounts start with Medicare, but then other payers like private insurance, they adopt specific rates as well. You want to know, are they following similar rates to Medicare, or are they following something different? You may also want to ask, are they going to have you sign an ABN? And an ABN is an advanced beneficiary notice, and it's part of the paperwork that decides or indicates whether something is or is not covered by Medicare. So we'll get into that a little bit later, but just some questions for you to think about and consider as far as your DME supplier and their insurance knowledge and how it cross-sects with the Lymphedema Treatment Act. So a quick reference list of just knowing before you go. Your eligibility for coverage. So some insurance companies may or may not cover DME supplies, and specifically may or may not cover lymphedema compression products. Of course, the Lymphedema Treatment Act started with Medicare, but there are hundreds, if not thousands, of other insurance plans out there. And so you need to understand, for your specific plan that you're enrolled with, are you eligible for coverage for compression garments? You'll also want to understand, what's your out-of-pocket cost specific to your plan. Some health plans have deductibles, some have copays, some have coinsurance. Much of that depends on what you selected during your annual enrollment process. For Medicare patients specifically, the deductible in 2026 is $283, and then you have a 20% copay after that. So once you hit that $283 deductible, then your compression garments could be eligible for a 20% copay. You'll also want to be aware of medical policy criteria for your health plan. Medicare has not published a specific medical policy at this time, but other payers do have policies. And those policies set qualifying criteria, and they explain when patients may or may not qualify for compression garments or potentially for standard versus custom products. So each health plan may have a medical policy that you should become familiar with. I also mentioned a little bit earlier the difference between standard versus custom. Some patients will fit into those standard products. Others will require custom, unique products for their body. Different health plans can also have different quantity limits. So for Medicare, you're eligible for 3 garments for each affected area for daytime every 6 months. For nighttime, you're eligible for 2 garments for each affected area every 2 years. Within the other health plans, the private health plans or Medicaid plans, they may have different quantity or frequency limits. There may be 3 products or 4 products eligible for replacement every 4 months or maybe only annually. Again, each health plan has different rules and limitations, so you'll need to become familiar with what is specific to your plan. Same concept for that reorder frequency, as I mentioned. It could be every 6 months, every quarter, every year, just depends on each health plan. And so just a quick recap of that process for patients. Of course, there's a lot of burden on the patients and the clinicians as you all are advocating for yourself, but at a high level, we'll go back to the beginning. It starts with scheduling a visit with your clinician. So you're going to need to see your regular doctor or whichever doctor is treating your lymphedema, and you then may also work with a lymphedema therapist as well. You have to discuss your treatment plan, whether that includes manual lymphatic drainage or some sort of intervention, in addition to compression garments. It's important that you advocate for yourself and request that within that documentation, when they're at their computer typing in their medical records, please advocate that they put the ICD-10 code within the medical records. It's an important step in qualifying you for coverage that lymphedema ICD-10 code is within your medical records from your prescribing doctor. There are 4 specific codes that are recognized by Medicare, and those are available on the Medicare websites. You'll then also get that prescription for your products, and at that time, the patients then have to choose a DME supplier to work with. Of course, we gave you some information about how to choose a supplier, and then you'll go through the measurement and fitting process, and then make a payment. And with that, I'm going to hand it over to Noel to get into some of the more exciting insurance details.
Well, thank you, Carmen. And I love the fact that you set it up for excitement because it can get very complicated. And typically the language that we speak, we speak a lot of cryptic codes because we speak to providers. But today I'm going to make a really conservative effort to just really bring this down into term and language that you can understand. I'm looking at the Q&As popping up and there's some great questions. So I'm going to try and get through this as quickly as possible so that we can answer some of your specific questions related to billing. So one of the things that you must do, and I think Carmen and both Heather and Carmen actually talked about this, understanding your insurance network and your benefits. There's so many different plans out there. Whether you're Medicare eligible, now even if you have Medicare, you can be on a Medicare Advantage plan that is sponsored by a private insurance company. So it's your Medicare benefits, but it's administered by a private insurance company, whether it's Aetna, United Healthcare, and so on. And then there's Medicare, Medicaid, and if you're military oriented, there's private insurance, there's employee sponsored plans. So there's so many different insurances out there. And the policies will vary, as Carmen mentioned and alluded to earlier. It will vary based on your insurance. So it's very important for you to reach out to your insurance company and to get a better understanding of your policy. Now, I'll say this, since the passage of the Lymphedema Treatment Act, we've seen more adoption of other insurances extending coverage for these garments before that there was no coverage afforded. So when you reach out to them, the customer service representative might not be familiar with compression garments, and they might even ask you for the HCPCS code. to try and determine if coverage does exist. I understand coding is very complicated and you may not be able to identify the code. But a general rule of thumb is you can ask them if DME is covered. And if you don't understand the specifics of the HCPCS code, ask them for the list of DME suppliers that are in their network. And maybe you can reach out to that supplier and they can assist you with the eligibility and verification. And once you have established the HCPCS codes, then you can go back to the insurance and ask, hey, what are my benefits associated with these HCPCS codes? And there are some additional resources that will probably provide, like the PDAC, where you can plug in the manufacturer's information and you might be able to locate the HCPCS code and so on. I don't encourage you to go and Google it because Google will return a lot of information that may or may not be accurate. So really just look into these official channels. If when you reach out to your payer actually says, I don't know what compression garment is, to tell you if you have benefits or not. A good way is to start asking about DME, right? And potentially that will flag them to say, okay, well, these are your benefits specific to DME. Here are the contracted supplier. And now your next step is to reach out to these suppliers to get the HCPCS codes if you do not know them. Sometimes the therapist might be familiar with the HCPCS codes. And by HCPCS codes, we're talking about with Medicare insurance companies actually speak language of codes. It's not your description of your garments that is transmitted. Those garments are actually crosswalked to a HCPCS code that is transmitted electronically to the insurance company. And that's how they know whether it's a knee-high, a custom garments, and so on. So we'll touch a little bit about that and build in some miscellaneous codes. But they also use modifiers. So as you get it back, your explanation of benefits, you might see some 2 characters digits on there and you're like, well, what are those? You'll see an LT and RT or an SC or a KX. These are really just signals to the insurance company what side of the body the garments are used for or what part of the body. And there's some of them that indicates coverage. So HCPCS codes and modifier, don't expect you to be experts at it, but if you get the same garments over and over and over, you probably will become familiar with the HCPCS codes that are utilized. And when you reach out to your insurance, if your insurance changes, you can reach out to them and give them that specific HCPCS code, and then they'll give you some insight as to what your benefits are, whether it applies to your deductible, what your co-insurance are. And those are very important as we get into some of the next slides about understanding your benefits. Next. All right, so there are each pair, as I said, is really pair specific. We have pairs that we deal with that the claims have to be submitted within 60 days. We have other pairs that will allow the claims to be submitted within a year for providers to submit the claim. And that's important for you to understand as well, because you don't want to be caught up with potentially a balanced bill because a claim wasn't processed timely, because maybe they're waiting on an authorization for you to sign off on to authorize them to submit your claim on your behalf. So when you're calling the insurance company and you're asking about benefits, it's also helpful to ask about what their timeline for claim submissions are, correction in claims, potential appeals. All of those are things that it's helpful for you to have. A good supplier will actually have this information available when they call to verify benefits. But ultimately, we're talking about your responsibility here and understanding your own benefits so that you're not surprised when you receive a bill, or if you receive a bill that you think is inappropriate, you at least have that information. You've been educated by your peers to what to expect. The insurance verification should be done before you actually look at a supplier, right? Because not all suppliers are created equal. There are in-network and out-of-network suppliers, which we're going to touch on that in a little bit. Move on to the next slide. But there are basic benefits that you need to understand, the difference between in-network providers and out-of-network providers. So we're going to really simplify this for you. In-network suppliers are suppliers that have worked with your insurance company and they've negotiated rates and price for specific items and services. There are some items within the lymphedema garments that are not individually priced, but they're called miscellaneous code or not otherwise specified code, that there's typically contractual agreement between your provider and the insurance company how they pay those claims. Sometimes it's the cost of the garment plus a markup. Sometimes it's a percentage of the bill. These are terms that are negotiated and are binding between the provider of service and your insurance company. But the insurance company negotiates these savings for you so that you can benefit. And the benefit to the supplier is they oftentimes get exclusive access to be able to furnish these items. So they make up for probably some lower reimbursement in the volume that they get. So it's an entire business contractual relationship for in-network providers. In-network providers, your out-of-pocket expense for the most part typically is lower because of these negotiated savings that you will get from your insurance company. Out-of-network provider though, it's a little tricky with out-of-network providers because out-of-network providers are not contractually bound by the same terms that a in-network provider is, which means that they can potentially balance bill you for balance that exceeds what their expectations or what your plan actually pays. And sometimes too, your plan straight up will not have out-of-network benefits. Maybe it's an HMO plan and your particular supplier is not within that network. So that provider will not even be paid. So you might end up incurring the entire cost of your garments if you don't check for these. There are times when out-of-network providers are allowed. Let's say, for example, you have a PPO plan, and that PPO plan allows for out-of-network benefits, but sometimes your out-of-pocket expense is going to be higher because your deductible might be applicable to that claim when it wouldn't have had you gone to an in-network provider, or there's a higher copay because you went to an out-of-network provider. So it's very important when you're choosing suppliers, and this is really reinforcing what Carmen and Heather both said. Make sure that that provider is within your network. And if they're not within your network, then make sure that the benefit is consistent with what you expect and what you can afford, as it may come with a higher out-of-pocket expense. Reviewing the policies for clarity. See, a lot of what was said earlier is understanding your benefits. Medicare policy, Medicare guidance for coverage is very straightforward. It's pretty much having a diagnosis and having the clinician justify the need for the item that is needed. Some of your policies can be a bit more restrictive. Some of them can be as open as Medicare policy is. So it's understanding the policy, not expecting you to become medical experts in reviewing the policy and understand the technical languages, but most importantly, and I think both Carmen and Heather have said this, is work with your clinicians, work with your physicians, work with your physical therapists. Make sure that your records clearly document the need for the garments that you need. When you read it as a layperson, you should be able to say, okay, now I understand why this is needed. You have access and the right to request your own medical records to review for accuracy, because these are going to be the documents that determines your coverage, whether a prior authorization is required, or if the claims have denied and there you need to file an appeal on those claims. Next slide, please. All right, and understanding your explanation of benefit is a big thing that we want to touch on here. And I have some examples really that some illustration in the next slides to kind of give you kind of a billing 101 and trying to understand your EOB, right? Sometimes your insurance company mails these to you. Some of you might have access to them electronically where you can go on the portal or the website to view your EOB, but sometimes it can be a little bit confusing, right? You're not used to all these codes. You're not used to these terminologies. So I'm hopefully going to be able to give you a crash course very quickly in understanding the explanation of benefit. You may not be an expert when this is all done, but hopefully it will give you kind of a general foundational or fundamental understanding of what some of the elements of an explanation of benefit is. And if there's ever a question, you can always reach out to your insurance company for them to verify. Their customer service reps are available. So some of the things that we want you to look at, make sure your date of service is accurate. And the date of service on the claim is oftentimes either the shipping date, the date it's delivered to you, or the date that the supplier sends somebody out to your home to deliver it, or if you pick it up in store. So make sure that those date of services are accurate. Make sure that it's one of those dates that I've described. Verify the denials. If the denial is on your explanation of benefit, it should trigger some actions for you, whether it is you're reaching out to the supplier or if you are going to call the insurance company. Understand that this is very important. Patient responsibility. Make sure that you monitor patient responsibility. If the EOB says you are going to be responsible for X, Y, and Z, you should reasonably expect that the supplier is going to bill you for that charge. On the contrary, if your explanation of benefit says you are not responsible for this service, you should not receive a bill from your from your provider. And if you do, then that is when you take two things and say, hey, look, my explanation of benefits says I'm not responsible for this, but yet you're charging me. And if the provider are unwilling to resolve those issues, then that is when you bring that to the attention of your insurance company to make sure that that is clarified. Make sure that the supplier name matches, right? The supplier that you're dealing with is the supplier that is billing the claim. We are cognizant of the fact that there are fraud, waste, and abuse that permeates any industry, and we're not immune. So just make sure that when you get your EOB, you're looking at it to make sure you, one, know about these services, and two, you know the provider who provides these services. And if you do not, you probably want to make an attempt to reach out to the provider to say, why am I receiving an explanation of benefit and I've not gotten anything from you? I don't know who you are. And then if it was an error, hopefully they get it resolved. But if it's not an error, you definitely want to report that to your insurance company as a potential fraudulent action. Looking at the remark codes oftentimes tell the story. So just for illustration purposes, I'm going to look at some examples. If you can move on to the next slides, and I'll just show you some typical elements of an explanation of benefit. This is from one of the common insurance company, and these are some of the things that we talked about. The product HCPCS code, it's not going to have the description necessarily. Some of them do, but most of them have this HCPCS code. So working with your provider, you can again figure out what the description of these HCPCS codes are. Make sure the quantity is consistent. If you only receive one garment and it shows that you have a quantity of 2, that's important. Guys, that's important to make sure that you monitor that. The amount billed, insurance company, suppliers, can bill pretty much within reasons, anything they want. The billed amount shouldn't be as alarming to you, but what's very important is the allowed amount. Because an insurance company could bill $500, $5,000, but if the insurance company says this is what we allow for the service, those are the numbers that makes the difference. So in this case, this provider billed 2 accessories for $865.93, and they billed a total of $300, and only $150 was allowed. So based on the negotiation between that supplier and the insurance company, you just saved $150 just off the bat because of the negotiated savings with the billed versus the allowed. And then the insurance paid $112. And they're telling you that your responsibility is $37. So this, if this were you, the provider shouldn't be asking you to pay $150 or $160. You should not be paying more than $37 because this is what your explanation of benefit dictates that you should pay. We can move on to the next slide, please. So here's just another example of an EOB. They all come in different form shapes, but there's certain things that are true. The date of service, as I said, you should make sure that that date of service is either the shipping date, the delivery date, or the date that you physically sign for the item. The billed amount will be there, the allowed amount, and the important things are those patient responsibility, guys. See there, 308.29. If this is you, no one should be asking you to pay more than that 308.29. We can move on to the next slide, please. And again, this is just another example. I just gave different formats because the feel and look might be different, but the concepts fundamentally are the same. Making sure that member responsibility highlights and delineate your responsibility, and ensure that folks are not asking you to pay more. There are some instances where upgrades might be an issue here, but specifically looking at your EOB, you can use this to say, this is what my responsibility is going to be. We can move on, please. All right, so advanced beneficiary notice. Carmen touched on this earlier, and I want to just run through this very quickly just because I want to make sure that we leave enough time to answer your question and give you guys all the resources that we have available for you here today. But an advanced beneficiary notice is basically the way that CMS dictates for any providers who provide services to Medicare fee-for-service to transfer financial responsibility, from the provider to you. It's, as the name suggests, advanced. So it has to be given to you before the services are provided. So the provider can furnish the item and then later on says, hey, can you sign an ABN so we can charge you for this? And the whole purpose of it is for Medicare, for the provider to explain to you why the items and services are not covered by Medicare. And that needs to be explained in terms that you can understand. So they need to specifically say why your items are not covered and have you sign the ABN that you're accepting financial relationship. ABN is specifically for Medicare patients. It does not apply to Medicare Advantage plans or any other payers. However, other payers might have similar forms, a transfer of liability form, or some supplier might even craft their own version that basically explains that you understand it's not covered by your insurance company and therefore you're accepting financial responsibility for that claim. Moving on. So here are just some of the common denials that we see for lymphedema treatment items, same or similar. If the provider has a specific limit, Carmen outlined what Medicare is. For the other insurance companies, it varies. I've seen some insurance companies that are super restrictive. I've seen some of them that are more relaxed than the limits that Medicare allows. So it really just varies on your insurance company. But if you're getting the same or similar item within a specific time frame, then that can cause a denial. So don't shop around suppliers and get some here from other supplier. Stay with one supplier as long as they're providing the quality items and customer service is great. Just stick with one supplier and don't let anyone call you on the phone and solicit you to just sign up and to give them your information, because your information can be utilized for fraudulent means as well. So be cognizant of that. Place of services, these are more technical issues, but the garments are supposed to be used at home, and if sometimes there's other place of services. Coordination of benefit is a good one. If maybe you have a liability insurance, a car accident, and your insurance company is made aware, sometimes those will call claim denial because your insurance company wants to make sure that the auto insurance is not responsible for the provision of these items as opposed to them as your major medical. So those are things that you can work with the supplier to resolve. Typically, it requires you to provide some documentation to your own insurance company, and they'll get that updated. Incorrect coding is a common reason. Medical necessity. So I know you heard Carmen and Heather both emphasize on this. Make sure that it's documented in your physician's medical records, your diagnosis. That is one of the top denial reasons as we see audits providers are facing. And they're telling patients, well, we cannot give you your resupply because we don't have the right documentation. So have those conversations with your physicians. Make sure that they document the diagnosis of lymphedema in your medical records. Your therapist that is evaluating you, make sure that they're documenting the need for the garments that you have. And billing accessories. There's certain information that is required when you're billing for the accessories, and we can jump on to the next slide. We're wrapping up to the end. And I think I saw a question that popped in as well too about asking about this. So some of the garments have specific assigned HCPCS codes, but then we talk about the NOC codes, the miscellaneous code, the catch-all, if you may. So for accessories that are not specifically coded by CMS, they have given guidance as to how to build those codes. So you'll see the E6593, it's a miscellaneous code for all of those miscellaneous things like zipper, dotting and doffing aid, close to silicone band. All of these accessories that typically comes with the garments, they're billed to the insurance company. So don't be surprised if you only got like one pair of garments, but when you look on your explanation of benefit, you see multiple accessory codes, A6593, because each one of them, they have to bill with a narrative explanation as to what it is that they're, because again, it's just HCPCS code. And this HCPCS code just says accessories, right? So they have to have some other ways to communicate to the payer what the item is. So in the narrative of the claim, the insurance requires them to put the manufacturer's information, the MSRP, and other information that are necessary for them, for the insurance company to decode what that actual code means. We can jump on to the next slide. Your right to appeal, real quick. So understand that you have a right to appeal. One thing I will say to you is that if you receive a denial, don't just take that appeal up by yourself. Reach out to your provider of service. Make sure that they're not already planning on appealing that claim, because if you appeal it, you might take away the appeal rights. And they're typically experts within the supplier's office that knows what needs to be submitted. You can't just submit it back to your insurance company and say, hey, I've been paying this for 20 years, please pay my claim, right? That's not how it works. They typically want providers to submit medical records, invoice, proof of delivery, prescriptions from your doctor. All of these are elements that need to be included in the appeal in order to ensure your success. So don't just take it up and just write a letter to say, hey, I have lymphedema, these should be covered, please pay them as soon as possible, because that may not get you the desired results. So work with your providers, look at the denial reasons, and navigate the appeal process. Understand the time frame. If your providers themselves decide that they're not going to be filing the appeal, then you can take it on, and then you can probably reach out to the Lymphedema Advocacy Group, and team will help you navigate that process specific to your payer as much as they're able to. And I do myself lend my expertise on a volunteer basis to help navigate those terrains when those issues do come across the LAG group. So just understand your appeal rights, and we can move on to the next slide, please. And this is just an appeal decision, and this is just our last slide. So we can move on to the next slide. I wanted to turn it back over to you, Heather, just for some additional resources.
Thank you so much, Noel. So I'll move through these quickly so we can get to our Q&A. And just a reminder, if you have a question that you've not already put into the Q&A, please do so at this time. I'm just going to review some additional insurance-related resources that are available through our website. This here, oh, the QR code seems to be missing for some reason, but this is our appeal resources page. This is available through our lymphedemaadvocacygroup.org website under the Take Action tab. So you can navigate to it from there. And this page has very helpful information for all types of insurance plans and all situations. And we highly encourage you to appeal any denial, as there is a high chance that you will win your appeal. We understand it can be a time-consuming and frustrating process, but this is how we make change happen, by not accepting no for an answer. Oh, they're all missing for some reason. The QR codes do not seem to be coming through, unless other people can see them, even though I can't. So this is our denial reporting form, also available under the Take Action tab on the lymphedemaadvocacygroup.org website. Please do share information with us about any denials or other instances of insufficient insurance coverage. This is very helpful information to us. Although we cannot typically get involved with individual cases, this information is what allows us to identify trends and make informed decisions about where to use our time and resources to try and make improvements and changes that benefit everyone. Also, under the Take Action tab, we have a coverage report and survey. So we started this last year in 2025. The coverage survey will be open during the month of September each year, and then we use the information gathered to issue a report in November that patients can use to make more informed decisions when they're choosing their policies for the next year. So of course, policies can change from year to year, but what they were covering or not covering during the current year is a good indicator of what their coverage will be like in the next year. And we hope this helps patients make the choices that are best for them and their lymphedema care. Next slide. The next series of slides are information available through our LEAP website, which is at lymphedemaproject.org. So we have a variety of handouts. This one in particular, whoops, if we can go back a second, this is the patient handout here. We have different handouts for patients, providers, and suppliers. The front side of each handout is the same information because it's the basic information everyone needs. but the back side is specific to each audience. So you can see here on the back side of the patient handout in the lower left corner, there's a really helpful graphic that helps you to understand when you're eligible to reorder your compression supplies, especially if you didn't get all the sets you're allowed at one time. And now if we can go to the next slide, this is our provider handout. The back side of this document contains helpful information for your doctor to understand about the importance of the diagnosis and the details that need to be on the prescription and in the clinical notes. And then the third handout in this series, if we can go to the next slide, is for suppliers. And you'll see on the back side of this one, it also has information about the level of detail that must be included with the prescription and the clinical notes, and some other billing specific information like the modifiers that now have to be used as of the first of this year. And on to the next slide, you'll see, oh, right, this one's got the QR code. So this takes you to our educational materials page for all of the items that I showed you, as well as other items. All of the handouts can be downloaded for free to distribute electronically or print on standard paper, but the information cards that you can see here, you can actually order 100% free of charge through our website, and they're perfect for distributing in doctors and therapists' office or at support groups or any place where people might be needing information about lymphedema in general or about the insurance benefits that may be available to them. And last but not least, please subscribe to our newsletter. If you're not already on our mailing list, this is the best way for you to stay up to date, informed, and engaged in all of the things that you need to know to advocate for yourself and get the best care possible. And sorry, once again, the QR code is not showing up for some reason. But with that, we're going to move on to answering your questions. And just a reminder, if we don't get to answering all of the questions live, you will be receiving a follow-up email at the end of this webinar, and you can use that to respond to it with any unanswered questions. And you're also going to be receiving a recording of this webinar, and we hope that will be helpful as well. So I'm going to turn it back to Adam, who is going to read aloud our questions that have been submitted, and then all of us panelists will assist in answering those.
Sure, Adam, just before you jump back in, and I'm sure you're collating these questions and ready to fire, I just wanted to clarify one thing that I saw popped up in the chat. So the accessory codes that are billed with the A6593, it could be a separate attached accessory, or it could just be an accessory that comes with the garments, by the clothes lube or the silicone band. So just wanted to clarify that it doesn't necessarily have to be a separate attachment from the garments. But Adam, all in your court, sir. Thank you.
Yep, I'll actually hand this one back to you. So one of the questions, this should be a quick basic clarifier, just explaining what DME means and also differentiating between a provider and a supplier and what those terms mean. Great
question. Thank you. So DME, durable medical equipment. This is the benefit that lymphedema was created under. It's a Part B benefit for Medicare. It's just a term that is more familiar to folks than when you mention compression garments. Most of the insurance folks probably won't understand what you're talking about unless they truly know. But the DME should ring a bell for most of the customer service folks, since it's been a benefit that's been around for many, many years. But Congress, when they created the benefit, they designated under that realm DME posts, which is durable medical equipment, prosthetic, orthotics, and supplies. Great question. And then provider supplier, we can kind of use those words interchangeably. The supplier really speaks to the providers who, the suppliers, providers, we use them interchangeably for that reason. But for purposes of definition, supplier is the company that furnishes the items to you. They take your benefits, they submit the claim on behalf of, on your behalf. They oftentimes call themselves providers, but provider is also used for your doctors, your physician, the provider of care. So it really just depends on the context. It could be the same as well, it can be different. The physician can be considered a provider as well as the DME supplier. Hopefully that helps.
And then here's another clarifying question. I think this was more or less addressed during the presentation, but can my orthopedic or occupational therapist cover my lymphedema care, including writing prescriptions? And can an ICD-10 code be in the therapist notes, or does it have to be in physician notes?
Okay, so let me take that one, Carmen, Heather, if you don't mind. So the therapists are not diagnostician. So the diagnosis of lymphedema must come from your physician. And by physician, we mean your MDDO, DPM, if it's within their scope of practice, or nurse practitioner. The diagnosis can absolutely be within the notes from the therapist, the lymphedema specialist, but it must absolutely be coming from the doctor. Now, as it relates to prescription, not aware of any particular state that allows for the therapist. I think I've heard rumblings of some states that are considering bill to allow therapists to prescribe, but I've not been able to independently confirm that. But speaking specifically from a federal level, a therapist cannot prescribe lymphedema garments, even if the state permits them to do so. The definition of physician from a federal level specifically speaks to MDDO, nurse practitioners, clinical nurse specialists, and so on. And therapists are not one of those credentials that would be able to prescribe D&E posts, which the compression garment falls under. So hopefully that answers those questions.
All right, another patient question. Since moving to Medicare, I've had to pay for my compression garments out of pocket. They're on a Medicare Advantage plan. When they call the insurance company, the insurance company says the garments are covered, but the supplier is not covering them. How can they, and they're wondering if that's because of the ICD-10 code, but I think maybe there's a little bit broader answer we can give there.
Yeah, I can probably take a crack at that one as well. So I would suggest contacting the supplier to find out why it's not covered. There could be a myriad of reasons. It could just be that they don't have the medical records from your physician that supports the coverage, right? And if that's the reason, then you just need to get with your clinicians to make sure. It is a covered benefits, and just for all intensive purposes, because it's covered by Medicare, Medicare Advantage plans must cover it as well, as long as you meet the coverage guidelines. So it should be covered. There shouldn't be any reason why you have to pay those out-of-pocket expense. It also could be that the supplier that you go to, we talk about network ad nauseum here today. It's a possibility that the supplier who you went to is not within your network, and probably that's the reason why they chose is not within the network of the Medicare Advantage plan you chose, and therefore they cannot bill your insurance company for those benefits. But it's not that it's not a covered benefit. It's just there's more to that story. And I would encourage that you actually reach out to the provider who is charging you for those services, because it should be a covered benefit.
All right, Carmen, here's one I think you can probably answer. There's still no code for knee garment, which is often needed. How can that be remedied? What code do we use in the meantime?
So I believe that they're specifically referring to the adjustable wrap garments. Within the USMCA, we are advocating for additional HCPCS codes, and we had previously asked Medicare to establish a knee garment code. At this time, they did not choose to create a new code, but in the meantime, you are supposed to use the miscellaneous code for adjustable wraps. So there's a not otherwise specified or miscellaneous code. So since a specific code for knee does not exist, you have to use that miscellaneous or not otherwise specified code. What's important then about the claims being submitted is that within that narrative area, they describe that it is a knee wrap, because Medicare will review that data annually. So they'll take a look at all of the claims submitted under that not otherwise specified code. And we believe that they'll take that into consideration for establishing additional codes in the future. So short answer is yes, there are multiple groups advocating for additional HCPCS codes. And in the meantime, if there's not a code that meets your needs, to use the not otherwise specified or miscellaneous code, but in the narrative section to use those descriptive words like knee, so that CMS can see that information and hopefully use it to fuel their decision making for additional codes in the future.
And to that point, though, Carmen, there is a contractor, the PDAC, that literally that's one of their tasks. They run through all the claims data annually and look at items that are billed with the miscellaneous code so they can suggest to CMS the creation of more specific code. So the more narrative you include, obviously cause your claim to be paid because the reviewers will know what it is, but that data element is also helpful for them as they try to reduce the number of knock codes being billed.
All right, so we have another patient who's been wearing custom compression for 15 years and is stable, so doesn't often visit their healthcare provider related to their condition, but insurance has denied them because they don't have a recent documentation. So what do insurance companies want to see for stable lymphedema?
I'll take that one as well. And Carmen, you can chime in as well. I saw that you went off mute, probably a little bit quicker than you did. But so in for stable lymphedema, there's a maintenance phase, right? And compression garments are considered maintenance items. So there's not necessarily any need for documentation to talk about acute lymphedema or anything like that. The only documentation that you need is just to document that there's the need for the garments. Now, every year, or however the frequency, you're probably going to need new garments. So what the insurance company wants to see is that it continues to be medically necessary. So when you follow up with your doctor, when you follow up with your therapist, ensure that they're still documenting and put it within the notes that you still need your garments and why the garments are needed and the benefits that are being achieved. So that's where you probably need documentation. If you've not seen a clinician in like 2 years and you're asking for garments, most suppliers will probably say no. They'll ask for something more contemporaneous, perhaps within the last year or 6 months or so, just to make sure that there's clinical evidence to support that the item continues to be reasonable and necessary. Carmen, anything to add?
No, that's absolutely it. And part of the patient process is just having that recurring documentation. So you're trying to get documentation of continued medical need. So even though you're in that maintenance phase, Medicare or any insurance company wants reassurance that it's still clinically appropriate, that you still have the right products. And so they're looking for that documentation. I believe the requirements can vary, but it's at least annually that you still have that condition. It still is a continued medical need that requires maintenance, to Noel's point. So it can be during your annual checkup or any annual interaction you have with a physician to capture that continued medical necessity for it.
All right, and I think we have time for one last question. And then as we noted before, we'll answer the rest of the questions in the email that goes out. We'll also make sure we include the links to the QR codes that we're missing so you can access those resources. All right, so the last question, can you explain what it means when a supplier takes a claim on assignment versus not on assignment? And Noel, you're muted.
Again, off mute. All right, thank you. Carmen and Heather, I see you guys have been busy responding to these questions in the chat. So I was just trying to jump in to fill in. But to answer your question, yeah, and this is I'm glad you asked this question, Adam, because this is very important. Not because, especially speaking for Medicare first, not because a provider is listed on Medicare website as a non-participating provider necessarily mean that they will submit the claim as unassigned. So let's just talk about unassigned versus assignment versus non-assignment first. Assignment means that the provider of service will accept the adjudication from the insurance company as paid in full. So if the insurance company says this item is only worth $150, that means that the provider, when they submit the claim, they have to indicate that they accept assignment, and they will accept that $150 in full. So that protects you because you have no risk of balance billing. The only thing that you would be entitled to pay for would be your co-pay, deductible, co-insurance. Unassigned, though, is slightly different. Unassigned means that the provider is not accepting what the insurance company has designated for that service. And you'll probably see some providers choose not to take assignment on some claims because maybe the cost of the item exceeds the costs that the provider is trying to reimburse. So they may choose to bill it unassigned and bill you for what they want to be reasonable, which is probably their costs and their moderate margins. And then sometimes when the claims are billed unassigned, the insurance company sends the payment directly to you. I know under Medicare, the payments are sent directly to the beneficiary. So that's a very important distinction. Assignments offer you the protection because then the provider cannot bill you in excess of what the insurance company says that is your cost sharing responsibility. Unassigned, it's the wild, wild west. The payer pretty much can bill you within means pretty much anything that they want. So you definitely want to understand whether or not the claims are going to be submitted assigned versus unassigned. I know under Medicare, if the provider is a non-participating provider, they have the luxury of taking assignment on a claim-by-claim basis. So if they're not listed on the Medicare website as a participating provider, they can bill a claim assigned as well as unassigned. If they're considered a participating provider, you don't have to worry because every claim they bill have to be assigned, right? So for under Medicare, if the claims are not going to be billed as assigned, the provider have to get you to sign off on a document that you are accepting that the claim to be billed unassigned. So it can't just be done without your knowledge, without your consent. You have to be aware. Typically with other payers outside of Medicare, if the provider is contracted within network, they're typically contractually binding to bill the claim as assigned. So again, staying within the network if of your plan gives you the best protection. And when it comes on to Medicare, just making sure that you don't sign a notice to say, bill this claim unassigned. And you should not have to worry about these things. But it's always best to have the claim billed assigned. It gives you as a consumer the best protection. Some suppliers might opt to go for the unassigned route because it gives them the latitude to legally bill you a higher cost than what you typically would have gotten under an assigned claim. Hopefully that answers.
Yep, I'm just going to jump in and say if you use our supplier directory and a supplier identifies as accepting Medicare as one of their types of insurance, they also have to then indicate whether they are a participating or non-participating Medicare supplier. And then you heard Noel's explanation that if they are participating, that means they're required to collect the claim or to process the claim on assignment, and you know that you won't be charged anything in addition. It also means you definitely don't have to pay anything up front. If they've identified as non-participating, that's when you need to ask and make sure that you understand if they're going to process the claim on assignment or not and follow Noel's advice. So another helpful aspect of using the supplier directory there.
All right, well, thank you everyone so much for attending today. We hope that this was educational and help you more easily access your lymphedema treatment items. Just to reiterate again, if we didn't get to one of your questions, we'll be following up with answers to all of the questions that were asked during the presentation in the email we provide, which will include that recording of the webinar as well. So thank you again and have a wonderful day, everyone.
Thank
Thanks,
you,
everyone.